Good morning, guys. So today I'll be sharing you one of the example of the actual nursing diagnosis. And right after this example, your task for today is to create your own nursing care plan. So that would serve as your activity for this morning. And for those of you who are not able to attend my Zoom meeting last time, you have to ask your classmates who were able to attend on that specific meeting, and then you try to ask them how to navigate or how to formulate nursing care plan, of course, from the assessment and up to the evaluation stage. Okay, I've already taught you guys on how to navigate your nursing Nanda. Your Nanda will serve as your pocket book in which all the details, all the terms and concepts were already discussed on that part. So your task is to locate a specific condition or a specific nursing diagnosis, and you will be redirected to the specific page, right? So I think na-discuss na ako na sa inyo, ha. So for those of you who are still confused o wala gihapon na gets, you can ask your classmate. Okay? But for now, I have to show you an example from assessment to evaluation and how to create your nursing care plan. As what I've told you weeks ago, that you really have to master the art of formulating your own NCP, okay? Because every time you will be exposed to a hospital experience, your instructor or your clinical instructor will going to give you a certain activity, and part of that is formulating your NCP while taking good care of your patients. So now I want you to focus and try to understand the given example. Okay? Your assessment here, like, dapat imong assessment, di ba, ginabalik-balik na ako sa inyo, ha, the assessment, the diagnosis, planning, and up to evaluation, dapat nag-correlate sila sa isa't isa. Dili pwede na ang assessment lahi, ang topic, apaabot sa diagnosis lahi. So, always remember nga, spontaneous, or shall I say, correlated sila sa isa't isa. Okay? Like for example, in your assessment, there must be a subjective or an objective. But of course, there are instances, guys, na wala tayo mag-other na subjective. Makita lang natin is objective, di ba? But in your example, your task for today is to give subjective and objective. Okay? So your activity for today will be discussed further after this example. Subjective, ma'am, pag mag-ubo ko kay naisagol plema, mao maglisod ko ginhawa, as verbalized by the patient. And always remember, when you're doing your NCP, dili tanan nga nakita niyo sa patient himuan yung NCP. You have to prioritize, okay? In prioritization, always remember kung unsa tong pinaka-urgent, mao to himuan ninyo NCP, which is also your actual nursing diagnosis. Gets? So, your objective would be, nakita nimo sa patient na sa dyspnea or difficulty of breathing, na abnormal breath sounds, na heart rate of 128 beats per minute, which is the normal heart rate is naalang sa 60 to 100 beats per minute. So 128 is already beyond normal. So it's considered as a abnormalities or outside of the parameter. And then there is also a presence of productive cough. So based on the assessment that you have gathered, you derive from a nursing diagnosis na impaired gas exchange related to collection of mucus in the airways, di ba na ay collection. And don't worry, guys, as what I've told you, this diagnosis, makita ninyo sa inyong nanda. So for you to follow, please go to page 374. So add to mo page 374, and you can see na dito ang impaired gas exchange related to the collection of mucus in the airways, diba? Kasi nga may productive cough, pasabot na siya yung mga plema sa sulod. As manifested by, look at to the objective data, as manifested by difficulty of breathing and an increased heart rate. So, mauna atong diagnosis. Now, let's sa planning. Go to page 374. In your planning, guys, makita po din ninyo sa inyong nanda. Always remember na ang iyong planning must be SMART, okay? It should be specific, measurable, attainable, time-bounded, and of course, realistic. So, dili pwedeng magplan mo nga, for example, 8 hours lang inyong pasyente, 12 hours lang mo sa inyong patient, then inyong mga plan is long term. It should be short term. It means achievable within your span of hours, okay? So here, within my 8 hours of shift, my patient will be able to, the first plan of yours will be demonstrate adequate oxygenation and with the absence of respiratory distress, all vital signs are in normal parameters. So, mao na imong first plan. The second one would be participate in treatment regimen like effective coughing and the usage of oxygen. So this planning, guys, you can see it and you can read that by yourself in your Nanda handbook, okay? So now your implementation, as what I've told you guys during my past lecture, every time that you intervene, every time you create an implementation, there must be a corresponding rationale. Like, for example, you can actually create independent, dependent, and collaborative nursing intervention. So, mao man na di bang tulo? And always remember, don't forget to always put a rationale every intervention that you offer to the client. Like for example, the first one, you establish rapport to the client. Of course, the rationale would that be to promote cooperation. Okay. You can actually create an intervention like 8 to 10, max na ang 10 or 12. Okay, as long as na may maisip nga related sa client status. The second one, monitor vital sign. Why? Because to detect any alteration or any deterioration with the client health status. The third one would be change client position every 2 hours. Why do we need to change the position of the every 2 hours? Of course, to maximize respiratory effort. And don't worry guys, this certain implementation nga gislat na ko diri, makita ra na ninyo sa atuang Nanda. Okay? So, I know there are some confusion. Naglisod pa mo ani gets, pero I hope that your classmates will going to help you. This is the time wherein you are going to reach out to your classmates who understand the lecture. Because I cannot go all over again with the topic kasi na-discuss na ko to through Zoom meeting 2 weeks ago if I'm not mistaken. The fourth implementation would be auscultate breath sound. So why do we need to auscultate? Of course, abnormal breath sound is an indicative of poor respiratory status. So it has to be evaluated for further intervention. So paano mo malaman nga there is actually already a deterioration or there is actually a poor respiratory status by doing an auscultation, right? The fifth intervention would be you have to elevate the head of the bed and position the client appropriately. So why do you need to do this one? Of course, to facilitate respiratory function by gravity. Now guys, in doing your nursing care plan, you are not allowed to use abbreviation. So I use this one it should be spelled out correctly. It should be respiratory kasi hindi na siya ano sa slide. So but in your formulating your NCP, you have to spell it out, okay? The sixth one would be use chest physiotherapy as indicated, of course, as ordered by the physician. And this, as you have seen or as you can observe, the first to fourth, or shall I say the first to fifth interventions are mostly independent, okay? Independent pasabot we as a nurse, it's our initiative as a nurse. But as we go along the way, the utilization of chest physiotherapy, increasing the fluid intake of the clients are already dependent intervention. Okay? So, ang ato ang implementation, it should start from independent, dependent, and collaborative. Okay? Why do we need to perform chest physiotherapy? Of course, to promote mobilization of the secretion. Since our ultimate problem is the presence of obstruction due to the increasing phlegm or increasing secretion nga na experience sa client, right? The seventh intervention would be maintain an adequate fluid intake as permitted by the physician. So there are actually cases kasi guys na um, patients are not allowed to increase the fluid intake, especially if na mga kidney problem or na mga edematous or nahupong ang patient. So since they are already edematous, we cannot instruct the patient to increase fluid intake because that might compromise their respiratory health. Okay? You have to maintain adequate fluid intake as permitted by the physician. Of course, the rationale for that is to mobilize the secretions. Number 8, administer medications such as the following, but not limited to bronchodilators and mucolytic. These following medications are their function is to facilitate the excretion of the phlegm, okay, to reduce the exacerbation of the symptoms and promote clearance of the secretion or phlegm. So as you can see here, it's dependent, purely dependent intervention, meaning we cannot give bronchodilators without the order of the physician. We cannot give mucolytic to our clients without the physician order. So we really have to rely sa ato ang mga doctors on this kind of intervention. The ninth one would be collaborate with the physician and other member of the healthcare team, of course, to facilitate holistic care. You have to collaborate with the medical technologist, to the radiologist, or the phlebotomist, or some members of the healthcare team, because we are doing or we are caring the patient holistically. So that those following implementation that I've mentioned, those are the most common. But in your NANDA handbook, you can just select 10 to 12 interventions related to the client and current status. So, mga itong mga implementation na example. And your evaluation, which is the fifth stage, after, di ba sa planning within, okay? And we are using will be because hindi pa man nangyari. But in evaluation, after my 8 hours of shift, my patient was able to, if your patient was able to, has to be correlated, diri sa ato ang balik diri sa planning. So ang moang evaluation dapat balik ka sa planning. Kung kaning duha ka planning nimo diri, um kung kaning planning nimo is na-achieve ba siya, okay? So after my 8 hours of shift, my patient was able to maintain an adequate oxygenation with normal heart rate of 98 beats per minute. Since our problem, di ba, 128 beats per minute, which is an indicative of poor respiratory status. Now, because you are doing something for the patient, you are trying to implement some independent, dependent, and collaborative interventions. Now, you are able to increase the oxygenation of the patient. At the same time, normal na ang heart rate sa patient, which is na-fall na siya sa 98 beats per minute, which is normal range of your heart rate. Okay? And there is also 100% oxygen saturation. The normal oxygen saturation of our body is from 96 to 100%. Okay? That's the normal range. And the patient were also able to participate in the treatment regimen, since involved pa po na ang apil sa ato ang planning, di ba? Nang ingon ta there participate in treatment regimen. Now, in your evaluation, you have to note na the patient was able to participate in the treatment regimen, thus goal met. Okay? So this is the best example na how to formulate nursing care plan. Okay, gets ninyo? The risk nursing diagnosis is just the same. Okay, the same lang siya sa actual. Nagproblema lang is wala siya. 2 formats lang ang iyahang. Sa risk kasi, 2 formats lang ang iyahang nursing diagnosis. Wala na ning as manifested by. For example, risk for infection related to prolonged hospitalization. Mauna siya ang risk diagnosis, kana lang sila, wala na tong as manifested or as verbalized, ganon. Muna sila, but the rest are just the same, okay? Maura na siya. Maura na siya ang imuhang bantayan sa risk diagnosis. Okay? So, that would be all. This must be the best example for how to formulate your nursing care plan. This will serve as your guide. Just look into it and make sure nga nag-correlate ang iyong assessment up to evaluation. I want to see na you're doing your best effort to formulate your NCP. Okay, now for your activity for today, I will give you so much time or an ample of time to create your own NCP. And remember, do not copy the NCP of your classmates. So make it sure it's unique and you have invested an effort to create your NCP because that might help you in the long run. Do not copy answers from your classmates because once I've noticed, you will be deducted by, a very like 50 points if nasakpan ta mo. So there ang 25 points each nursing care plan. So a total of 200 points because I'll be giving you 4 actual nursing diagnosis and 4 risk nursing diagnosis. You'll be creating 4 actual and 4 risk. And you have to follow this format. Okay? You have to do it boxes. You have to create a table. Okay? So just follow this sample. I-follow lang ninyo ni nga sample. Okay? And then the date and time of submission should be April 16, 2021. That would be Saturday on or before 5 p.m. So you have to submit your output through our Google Classroom for easy checking of your activity. And please be guided. And don't forget, I will still accept late outputs, but you will be deducted 50 points maximum. So I don't want to deduct points, guys, but I have to set a deadline or discipline you guys when it comes to submitting your activities and outputs. Okay, so please be guided. Please tell your classmates na naay activity for today. Please help each other, coordinate with each other because tabang-tabang mo guys because you have the same goal, you have the same aim, and that's to pass your nursing journey or just to pass your NCM 103. So that would be all for this morning, and I hope you will be guided, and I hope you understand and how to formulate your NCP, and feel free to reach out to me guys if you have some concern with regards to our today's activity. Okay, that would be all guys. Thank you for listening.